Hip flexion, closing the angle at the hip, lengthens the glute musculature. The hip range of motion assessment is primarily a glute flexibility test. Other factors like bone structure, hip socket depth, and its position, as well as stomach mass, can play a part in limiting hip mobility. Hip range of motion is defined by how far the hip can flex before hitting one of these endpoints or limiters. Understanding the rider's achievable hip range directly relates to their maximum hip range on the bike. Exceeding their hip range of motion on the bike can lead to excessive hip rock on the saddle, knees forced out over the top of the pedal stroke, and lower back strain. Exceeding available hip flexion can also make it difficult to reach the drops of their road bars. The fitter will be using the assessment table and the goniometer again, and the rider will be lying on their back on the table. This time the fitter starts with the goni at 90 degrees and sets it aside. Pick up the rider's leg by grasping the thigh at the back of the knee. Let the rider bend their knee to 90 degrees and use your forearm to support their lower leg. Press the leg up towards the rider's body, closing the angle at the hip. Pay attention to keep the leg square with their body. Do not let the leg move towards the outside or inside. The glute is a large muscle, so you will want to press firmly into flexion until you start to feel resistance. Once you start to feel resistance, look to the other leg, where the back of this thigh sits on the table. Notice if the other leg is starting to lift off the table. Take the leg back down a little, pause, then push it into flexion again. Watch the other leg and stop flexing the hip at the point where you start to feel tension increase and the other leg lifts off the table. Increased tension plus the other leg lifting off the table is the stopping point. Hold the leg steady and locate the greater trochanter with your free hand. Look down the center of the thigh, following the femur down into the hip socket. The trochanter is further back now than it was during the straight leg raise. With your palm, feel across the trochanter until you feel a noticeable drop-off. The center of the trochanter is now just before that drop-off. Center the goni on the trochanter. Short arm level with the horizon pointing towards their body, long arm pointing up. Hold the short arm steady and use your thumb to press the long arm into place, stopping with the long arm matching the angle of the femur and going straight through the center of their knee. Be sure to center the goniometer accurately on the trochanter. New fitters tend to make the mistake of holding the goni too close to the crease of their hip, which will result in a more open reading. The trochanter is the large bony mass at the top of the femur where the femoral neck turns and angles into the hip socket. Because of this angle, the trochanter swings down and away from the trunk of the rider's body as the hip goes into flexion. The trochanter is further back than you might anticipate. Use the palm of your hand to press into the side of the hip and move across towards the back of the hip. There will be a significant drop-off as your palm falls off the trochanter. Also remember, you can visualize down the center of the thigh and follow the line of the femur towards the hip. Follow that line and you'll always land on the trochanter. Document both left and right in V7, starting with the goniometer measurement in the small box. Full and limited range will automatically populate once the value is entered, with less than 100 degrees being limited. Try to be accurate to the single degree, not rounding up or down 5 degrees. Most of your riders will be between 105 and 125 degrees. The structural limit, where the femur hits the pelvis, is around 140 degrees. A limited result of less than 100 degrees will be challenging on the bike, not allowing much hip flexion over the top of the pedal stroke. Later in the fit, you will need to reference your exact measurement on the table. The more limited table measurement, the lower value, is the side that will be measured on the bike. This value represents the most closed angle of hip flexion the rider should achieve on the bike. This occurs when the rider holds their lowest body position, as when they are in the drops on their road bike and the leg is at the top of the pedal stroke. Exceeding the rider's available flexion will typically cause excessive hip movement as the hips move out of the way to clear the leg over the top. It can also cause the knee to come out, allowing the leg over the top. This additional movement can cause lower back pain as the body struggles for stability between the hips and upper body. Knee pain can result from additional torsional loads as it is pushed out each time over the top of the pedal stroke.